Hello all. I'm very glad to meet you and to show our recent published paper under the title Comprehensive Overview on Multiple Strategies Fighting COVID-19. This is our published paper, which you can find it in this link. And it is published in International Journal of Environmental Research and Public Health a short time ago. And I'm very pleased that this paper included different levels, started from university level, pre-master student, PhD, as well as staff members. The aim of this paper is to figure out different strategies to diminish the spread of COVID-19 pandemic in most affected countries all over the world, guiding other countries to be prepared for a second wave or another outbreak. At that time, even when we published this paper, it was no strong evidence that we will face another second wave. So, if we talk just a very briefly introduction about different types of coronavirus and their pathogens, it is different from 2 to 5 days mostly, these types, and only 2 types of 2 to 13 days. And the countries, it is global problem of these 3 types, while China here and this, as well as Hong Kong, and only Saudi Arabia was affected by MERS-CoV in 2012. As we all know, this is the symptoms of coronavirus: sore throat, headache, fever, cough, dizziness, muscle pain. But if it comes to shortness of breath, this is a serious problem. Then we have to really consult the hospital immediately. This is very simple diagram. It shows that it changes numbers of confirmed cases over the time. At that time, was United States is the top country regarding confirmed cases, followed by Brazil, India, then it comes UK, Italy, Spain, Germany, France, Iran, and the lowest was Korea, Australia, Singapore. What about the different strategies it has been used? If, for example, we take China, the government was acting this by updating information through the media. The diagnosed people immediately went to the hospitals. It has been more strict steps are introduced: isolation and quarantine, wearing protective masks and gloves, canceled major events. The state guarantee people's daily needs. They guarantee about what they need. Free medical care introduced by the state to the patients. If we go to the United States, at January 31st, they announced it. Then immediately they make restriction of entering to United States. The CDC and other governmental agencies introduced proactive steps to limit COVID-19. They prepare healthcare systems and they encourage public willingness for transmissions. And it clearly defines infection and directly report to public health centers to make decisions and improve medical safety. If we go to Italy, we can say it is red zones. Why? Because they make screening even for people without symptoms, and they hired immediately recruit 20,000 new doctor nurses in order to meet the demands. Coordinated intensive care units were equipped for positive patients, and the air travel were stopped. from China and Italy. Spain, France, it has been, we go to another countries like Iran. Then the commercial movement with China was prevented. They canceled the social events, closed the schools, and they established e-learning hotlines to answer questions and give advices to the people. Of course, poor people were severely affected by quarantine. The government sale and export of face masks to legal entities were limited, and they reduced offer hours. For India, at that time, the poverty and money-related problems complicated combating strategies. Diagnostic kits were increased every day and in every state. They had a phone application was launched, hotlines, a checkpoint has been built up, the train were turned to mobile wards for isolation, the governmental strict lockdown for 55 days for some service, etc. In general, the common governmental responses to COVID-19, of course, all this has been supported with references, which you will find it at the end of the slides. So, what's the strategies? They make health screening and the early detection, disinfection strategies and decay measures like social distance, control of communications and case isolation, enforcing movement limitation and shutdown of some cities, limited borders and limited international visits, informing people about coronavirus and strategies through media, allocated suspected cases to specific hospitals. The high-risk patients were moved immediately to specialized hospitals for intensive care. Public gathering areas were closed and public events were annulled. The governmental hired voluntarily health care workers and assigned army emergency teams. No non-essential business and schools were postponed. This is very simple diagram to show the comparison between total deaths in blue color and confirmed cases in some countries by this orange color. In the top of that, at that time, when we published the paper, was United States, was in the top, Spanish, Italy, Germany, France, UK, Iran, China, and the lowest at that time was Singapore, Australia, Korea. In conclusion, the countries that have previous experiences with viral infection diseases, most commonly is SARS, has a powerful primary care system with helpful infrastructure, guidance, rules, and instructions, and community awareness with social responsibilities, proven to be more effective in controlling the spread of infection and reducing its impacts. So this was very important. Also, the pandemic not only impacts the health system, but also expected to create global economic crisis. This is very drastic. COVID-19 is a targetly for us. It is for all of us collectively, but it is also an opportunity to ask ourselves, very important question, what kind of society we want after pandemic fades away? This is important. The other point is, we will discuss it with our new published paper, new accepted paper soon. By the end, you will find the references we had been used in our paper, referred to the slides you have seen. And I would end it with this, that we need collaboration. This is what we get. This is one of the mission we get from coronavirus. It doesn't matter the color, the gender, the country, but we need to cooperate with each other. This is the acknowledgement which the places has been supporting us for our research. Thank you very much. This is lovely Sweden during summer, and this is during winter, while I ended with my original home country, Egypt. Thank you very much for your kind attention.